of you on here right now may have like, oh, I had a bout of antibiotics and then, man, I had digestive problems for a year after that. You too?
C. diff, Brian.
C. diff is how I got here.
C. diff is how I got here, dude. Immune activation is not just about cold and flu and your immunity. I'm pointing out that immune activation actually triggers a whole lot of other pathways in the body. When this immune activation happens, you have to understand what's happened in your gut is a war zone. But before you even get the disrupted bacteria in your gut, what are some of the underlying causes that causes the bacterial mix, the blend between the good and the bad, to be out of whack, to be out of balance? Why are there sometimes so many bad characters and so few good characters in the gut? For me, let's look at the causes of what causes. Why are we creating environments in our own bodies? What's happened that's caused our environments to be so vulnerable to infections like these? And one of the things I just alluded to is the increase in food allergies. Okay. And I'm going to ask how many people this rings a bell with. Is that what we're finding is that what's happening at an alarming rate is that people are reacting allergically to more and more and more foods. And there's a lot of reasons behind it. In our programs, I really talk about how using just gluten as an example. And I'm going to ask you guys, how many of you guys know that you are sensitive or have a reaction to certain foods? Tell me what those are in chat right now, right? But using gluten as an example, we have selectively bred wheat and selected for specific varieties of wheat that contain more and more gluten. And why we've done that is for production, mass production of bread and stability of shelf life, so that they have a higher and higher level of gluten content. The more gluten there is in bread, the more there's a shelf life to bread. So environmentally, Brian, we've selected for foods that will have higher and higher content of certain allergens that a lot of people are sensitive to. Number one, that's one problem, right? Number two, we're coming to the point where we're using so much pesticides. We are feeding our animals a lot of antibiotics because we're mass growing animals. So we're taking a bunch of antibiotics, we're taking a bunch of pesticides, and the animals in the food that we eat have a very high antibiotic load. What happens when we eat this much antibiotics and pesticides, Brian?
Oh, it's a storm of effects, right? Not only are we consuming nutrient dense less food that triggers more allergies, but our innate and our acquired immune systems aren't what our parents and their grandparents were because we're
Yeah.
not outside farming and things like that. Add on to that the overuse of antibiotics.
Yeah.
Antibiotics, yes, they kill the bad bacteria, but guess what? They kill the good bacteria.
I
A lot
know.
of you on here right now may have like, oh, I had a bout of antibiotics and then, man, I had digestive problems for a year after that because you've just
18 months.
broken down. You too?
C. diff, Brian.
Oh
And
my
I
God.
feel like people don't talk about C. diff enough. Like,
C. diff is how I got here.
C. diff is how I got here, dude.
It costs on average about $12,000 to $15,000 per day to manage a C. diff patient, not to mention the mental anguish
They don't know what
and
it
the
is.
pain.
Brian, they don't know what it is. Let's tell people what C. diff is, okay? Because
Okay.
I'm actually I want to scream C. diff from the roof of my head because I feel like all the other infections gets all the attention. Um, C. diff is a product of taking an antibiotic. So certain antibiotics, whenever you take an antibiotic, I mean, they are big guns, meaning that they don't just, like Brian just said, they don't kill just all the bad guys, they kill all the good guys as well. And what happens is when you kind of clear a zone, guess what? Some certain types of bacteria that are resistant to that will start to grow and they have all the space to do it. C. difficile, Clostridium difficile, is one such bacterial strain that can be present in a very small amount in your gut. No big deal. But what happens is you put an antibiotic. In my case, Brian, it was after the birth of my first child. I took one dose. I had breast infection from breastfeeding. How many of you guys had that happen? And then I took one dose of doxycycline. And then immediately after that, it started me on a path of severe diarrhea, mucousy diarrhea, and that wouldn't go away. And this is, I mean, oh boy, I'm aging myself. This was like 23 years ago. And they didn't really even know. It took a while to even get a diagnosis. And I went through rounds and rounds of antibiotics after that to kill C. diff, which didn't work. I went through 6 rounds of antibiotics and it wouldn't kill the C. diff and it kept coming back over and over again. And that was the start of all my health problems. What about you?
It's awful. It's absolutely awful. I can diagnose C. diff from 3 floors down.
You can smell it.
That's absolutely if you've been there, you know.
Yes.
But it's so debilitating. It's so expensive to treat.
Hi, I'm Maggie UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform Protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. It's one of those things that these kinds of infections are becoming more and more common, and they're becoming more and more resistant to the point now where, some of these infections people have to treat in spacesuits because we don't want to spread it all around the hospital at this point. So it's interesting how I've seen the evolution of C. diff as it's an infection as a result of antibiotics. By the way, everybody, okay, this is a problem to me with the shotgun approach that we have in your conventional medical world, right? So your doctor don't believe that these infections in your gut are real, yet there's scientific proof beyond any doubt. Not only are they real, we can test for them and there are mechanisms underneath it, but there are also ways to deal with them. But the shotgun way of dealing with them, I call it the AK-47 approach, is throw an antibiotic at every infection. But the problem is having a C. diff infection shows you the folly of that approach is that you can then actually have a lot of resistant infections that come up. Whether you're eating antibiotics in your environment from your food, right, or you're taking an antibiotic because that's the only tool that your doctor has, we are actually selectively breeding for these resistant infections.
Absolutely. And you know what? I hate to disagree with you so early, but it's not an AK-47. It's an atom bomb. It is literally
Yeah,
blowing up everything in your entire
yeah.
gut. Good
I-
bacteria, bad bacteria, breaking down the gut lining, allowing all that stuff to flow through and keeping you in that hamster wheel of immune activation.
Yeah, 100% agree. For me, Brian, you mentioned that when people have these infections, it's not just about, oh, let's just clear all the infection, in which case you go to your regular doctor, they don't believe it's real. And if they believe it's real, they're going to throw antibiotics with you. We already see the problems with that. But one of the other problems is really, for me, these infections really cause a problem with malnutrition and digestion. So one of the problems is these infections will cause a problem because you have all these different steps in digestion, and we have a lot of videos around digestion. And this is the other thing is nobody is talking about the impact infection has had on people's underlying every single step in digestion can be affected. So we're seeing a very malnourished population or poorly nourished population as a result of this infection. And even their digestion absorption with a medication or food is really hampered. So it's almost like you can't reload. You can't reload your own immune system's ability to fight these infections.
When I counsel athletes and stuff like that, people that are trying to get that 1-2%
Yep.
above to be the best,
Peak
and
performance.
they're ate up with inflammation and gut issues and things like that. I tell them it doesn't matter how much water and nutrients and protein you take in, it's about how much you can absorb. And if your gut lining is chewed up and the body's just throwing it out the other end, you're not absorbing all that, which leads to that malabsorption and the inability to live your best life.
So I have a perfect example of this. One of our clients is an athlete and she's 22 years old and in college, trying to go to college and having severe IBS symptoms and trying to perform with high performance. And the incoming diagnosis was chronic fatigue and irritable bowel syndrome and POTS-like symptoms, postural orthostatic. So a lot of dizziness, fainting type of symptoms. Within the second or third week of working with us and getting educated on digestion, her IBS was gone. Her irritable bowel syndrome was gone. And yet nobody had ever spoken to her about digestion and not even thinking about infection. It's like, to me, infection happens sometimes as a result of poor digestion. I want people to think about digestion as every single step that you do to digest the food is an opportunity with which your gut is already protecting you from infection. It's almost like there's layers and armies ahead at every step, right? And that's why for me, one of the best selling products, let's talk science, okay, would be a multiphasic digestive enzyme product that has every step of digestion covered because so many steps are actually broken. So I would say the first stage of preventing infection, number one, is proper digestion. And which is why with digested, my recommendation for people is first of all, I have an upcoming book coming out. There is a book coming out in a couple weeks, everybody, in which I go into big part of the book about all the different steps in digestion and why we're not paying attention. It's like nobody's guarding your palace. There should be layers of palace guards and nobody is there. And so a really simple way is take a digestive enzyme that has a product that is multiphasic, covering every step: stomach acid, pancreatic enzymes, ox bile to cover fat digestion. I think that to me is step one. What can we do to fight and prevent infection? Proper digestion. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire, and that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those 2 trainings. They're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.